Kardashian. Of course I have a tanning bed.
I'm in a huge rush to go pick up my daughter at preschool, but I wanted to address this video from Kim Kardashian about tanning bed use. So when I was growing up, there was the thought that tanning beds actually were safer than the regular sun, that you could go and get tanning bed exposure and it wasn't an increased risk of skin cancer. And that is actually since shown to be not true. It is definitely an increased risk of skin cancer. And so a lot of dermatologists and others have admonished Kim Kardashian for advertising her use of tanning beds and having a tanning bed at home. But there is some argument that reportedly she has psoriasis. Psoriasis is a condition that generally does get better with UV exposure. Not for everyone, of course, but for some, getting UVB exposure really can help keep psoriasis in check. Now, that doesn't mean it doesn't also have an increased risk of skin cancer. So the safer way to get UV light if you have psoriasis is actually to get something called narrow band UVB. And that is what it sounds like. It's a narrow band of the UV spectrum. You can get it through a doctor's prescription. Usually it's offered in an office a few times a week. And at very quick appointments, they will measure the amount of UV you're getting. And in some cases, you can actually get a home narrow band device. Now, it's certainly not offered everywhere. Usually insurance covers it, but sometimes there's still a copay. And of course, there's parking and travel and time off from work to consider. While a tanning bed is definitely not a very good or safe solution, for some who don't really have access to this safer treatment, it can offer a lot of relief for your psoriasis if you're very careful. And there are some other skin conditions that respond very well to this narrow band UVB and UV therapy. Some forms of eczema, vitiligo, and other rashes. Okay, gotta go get my kid.